I'd like to introduce Dr. Shad Marvasti. He is the Medical Director of Integrative Medicine at HonorHealth. He is a Stanford-trained physician, medical educator, researcher, public speaker, and author. Dr. Shad is proactively engaged in creating solutions to promote health and prevent the chronic diseases of our time. As an emerging thought leader, he has published in the New England Journal of Medicine, where he and his co-author make the case for redesigning medicine to create a prevention-based healthcare system. As a practicing physician, he advocates for the use of food as medicine and actively teaches his patients to buy and prepare healthy meals with food prescriptions as a standard part of treating their medical conditions. As a physician executive, he is working to develop innovative clinical models that take a whole person approach to healthcare to proactively empower patients with the tools they need to optimize their health in all aspects of life. Will you please help me welcome to the Knowledge Lounge stage, Dr. Shad.
Thank you very much for that kind introduction. Thank you so much. It's a pleasure to be with you today. I want to give a shout out. I don't know if any of you met some of my medical students over here at the HonorHealth tent. One of the other roles I have is founding director of wellness and integrated medicine and nutrition at the University of Arizona College of Medicine Phoenix, where we're actually trying to redesign medical education to include these principles, these Blue Zones principles, so that physicians actually learn how to treat the whole person and to give you actual advice about what to eat and how to live your life. Right? So we're not just focused on your disease. The problem with the American healthcare system is that we don't have a healthcare system. We have a reactive disease management system, right? We're really good at acute care when you have an emergency or when you get in an accident, and that's really important. But where did that heart attack come from? Are you able to catch a heart attack like you catch a cold or the flu or COVID? No. A heart attack is the end result of decades of a process of chronic inflammation that leads to narrowing of the arteries called atherosclerosis. That's something that can be actually prevented over time. So we have a long period of time where we can actually promote health and prevent that heart attack from happening, but we don't focus on prevention, right? We focus on acute care. So part of what it means for HonorHealth to sponsor the Blue Zones initiative in Scottsdale is to say, look, we don't want to just do business as usual anymore. We don't want to just wait until you get sick, but we want to proactively empower you with the tools that you need to optimize health in all aspects of life. And now we're actually seeing scientific evidence that basically supports the many traditional medicines and healing traditions from indigenous peoples, cultures that are thousands of years old, that talk about different food practices, different meditation practices, healing ceremonies. We can actually now see at a molecular level how that actually makes you healthier. We now know from a number of different twin studies out there that genetics is only part of the story. Genetics actually only accounts for at most between 20 to 30% of health outcomes and longevity. That's only 20 to 30%. The majority actually comes from the decisions we make every day, where we live, where we work, where we play, how we connect or not connected with other people around us, the sense of community that we have. And in fact, what we're seeing is that our genes can actually be turned on or off depending on how we live our life. There's a field called epigenetics, which is basically epi meaning above and beyond the genes. So you can think about the genes you inherited from your biological parents as the hardware that we've been given, but then the software, right, if we look at it as an analogy of computer, is basically what we do, whether we are actually eating a healthy diet, whether we are feeling loved and supported and connected with a meaningful, authentic relationship, whether we are exercising and engaged. All of these things actually in a matter of a few weeks can turn thousands of genes on or off, which is really amazing. In the same period of time that it takes for us to change our taste buds, which is 28 days, we actually can turn on or off thousands of genes based on the food that we eat. And food as medicine is an ancient concept that's been around for thousands of years, right? You've heard this concept. But now we're actually seeing that the food we eat can actually turn genes on or off in just a matter of weeks. And if you go for 28 days and avoid the frankenfoods or processed foods, like I like to call them, right? They're not really real food. And that's the big difference. I want to give a shout out again to my medical students. We have a culinary medicine program where we actually learn about how to use food as medicine to prevent, treat, and reverse the diseases of our time. And after I speak, we have actually Chef Charlene Badman, who is a James Beard award-winning chef, who's one of our chef partners for the culinary medicine program, where we actually teach medical students how to teach you how to prepare meals, because we've lost the art of cooking. And culinary medicine is the combination between the art of cooking and the science of medicine and nutrition. You know, in medical education, medical students only get an average of 19 hours of nutrition across all 4 years of medical school. But the reality is that diet is actually the number one risk factor for preventable disease and death in the world. And yet we're getting barely any of that. And that's part of what Blue Zones initiatives, when you look at people in these long-lived centenarian places, they're eating healthy, real food. They're not eating processed food. So one of the first pieces of advice that I give to patients is to first start by recognizing what is real food. Real food is something that mostly comes out of the ground, or it's from an animal that eats things that comes out of the ground, that is not processed with antibiotics, with hormones, with all sorts of chemicals. And what the food industry has done, unfortunately, is that they've created these very addictive products that are high in sugar, high in salt, right, that contribute to the disease of our time, and very low in nutrients. So what happens is you have an almost endless cycle of craving flavors. But what they did back in the 1960s with gas chromatography is they separated out flavors from nutrients. So now you see all these products that are marketed with all these flavors. In nature, animals crave different flavors, and they don't have any knowledge of pharmacology or nutrition. But when they crave a flavor, they're getting a nutrient with that flavor, right? So if they're craving a tomato, they're getting lycopene. If they're craving an orange, they're getting vitamin C. But right now, if you're craving like a Dorito flavored chip, right, that has all these flavors, you're not getting any of the nutrients. You're not getting the fiber, you're not getting the protein, you're not getting the magnesium, none of that stuff. So it's an endless cycle of cravings that you're never going to satisfy. And that's what contributes to cardiovascular disease, diabetes, obesity, many forms of cancer. So we need to break that cycle. And part of what the Blue Zones initiative is to break that cycle. At HonorHealth, we have an integrative medicine. How many have heard of what integrative medicine is? Great. So this crowd already knows what integrative medicine. Okay. So integrative medicine is basically a whole person approach to health, mind, body, and spirit. We are looking at all the different aspects of your life that contributes to your health and longevity. When we look at the goal of healthcare and the goal of integrative medicine, the goal is not to cure and prevent, make sure that you never get a disease, right? When you look at these long-lived people, everyone eventually, unfortunately, gets some disease and dies, right? But the goal of prevention is to make that as far down the lifespan as possible. There's a concept called morbidity compression. So in other words, morbidity being sickness or illness, you want to compress that and have that towards the very end of your life. And you want to increase the period of disease-free, high-quality life. So when we talk about blue zones and centenarians and people living longer, you don't want to just technically live longer. You want to live better. There's no point to living longer if you aren't able to walk, if you're not able to think, if you're not able to connect with people and do all the things that you enjoy, right? And that means the concept here is not about lifespan, but health span. The difference there is that the goal is to increase that period of health span, which is the high-functioning, high-quality life that we all enjoy, for as long as possible. And that's what happens in the blue zones. People enjoy long health spans where they're healthier for longer. And that's the goal, right? We want to be able to prevent that. And how do you do that? What are the principles? What are the concepts? These are the social, behavioral, and lifestyle determinants of health. So one of the core concepts is diet, right? So first part is to eat real food. And in many of these blue zones, they do eat a plant-forward diet, right? And when I say plant-forward, I'm not talking about chips and French fries and fake meats, okay? I'm talking about real plants, okay, like whole beans, vegetables, whole fruits, right? A lot of times I hear people who are diabetic or pre-diabetic, and that's a lot of people, stay away from fruits. No, you shouldn't stay away from fruits. You should actually stay away from fruit juice, right? And sugary beverages. The whole fruit in nature, everything that is sweet and has sugar in it, also has fiber. And that's the secret. If you've ever tried to squeeze a glass of orange juice, it usually takes, 5 or 6 or more oranges, right? But if you actually peel an orange and you do all the chewing and everything you want to eat, you can't eat like 6 or 7 oranges, right, at one sitting. It slows things down. The fiber expands in your stomach, sends a signal to your brain and says, look, I'm full. So it controls your portion size. It also slows down the absorption of the sugar so you don't get a big a bump in your blood sugar level. And then you don't get a big bump in insulin, which is what causes diabetes. So that's why you do that. And on top of that, you can also add a handful of nuts and seeds, because the healthy fat and protein in the nuts and seeds combined with the fiber and all that lowers the glycemic load so you don't get a big bump. So I've had patients with type 2 diabetes who have an A1C of 10 or 11, okay, like an average blood sugar of like 300 or 400 walking around. And within 3 to 4 months, if we do this combination diet of real food, that A1C drops down to 6. And you can do that. You don't need medication for that, right? Medications are really powerful and they can save lives. Surgery can do that. And, HonorHealth has state-of-the-art facilities for all those things. But then we also have to look at what you can do, right? Because medications don't come without a side effect, right? 60% of all Americans are on at least one prescription drug. 3/4 or 75% of every doctor's visits results in a prescription medication. But when we think about all the different things that lead to the diseases of our time, what are the diseases of our time? Heart disease, cancer, diabetes, obesity. These account for 7 out of every 10 deaths and 77% of all healthcare expenditures. It's not a mystery what people are suffering and dying from. Chances are, just with you listening today, one of you may be affected directly by these or have a family member or friend who had one of these conditions, right? But these are linked to our lifestyle and our diet, right? You can't just give a pill for every ill, right? We want to take a whole person approach and we want to be able to do it. And that's what the Blue Zones is about. Another thing that's really surprising people don't think about, you might think about food as an obvious one, but what about relationships with other people? Meaningful, authentic relationships actually are a major predictor of health and happiness in life. A better predictor of health and happiness later in life than your cholesterol level, than the amount of money in your bank account, or how famous you are. They did a big study out of Harvard looking at this with all these graduates. And they found that those meaningful, authentic relationships, they don't have to be romantic relationships. They could be a spouse. They could just be close friends. And in fact, we've seen that in the blue zones, right? In the Okinawan blue zone, for example, they have the moais, which are these groups of friends that pool their resources together so that if one has an accident or falls, they're able to take care of each other. And they regularly spend time together 2 or 3 times a week. Having that sense of community can actually increase your lifespan, health span by 7 years, just by having that connection. Another area is being able to be part of a member of a group or a community, whether it's a faith community, a culture. That's another thing that can increase your life by another 7 years. What about exercise, right? A body at motion tends to stay at motion, right? While movement is life, stagnation is death, right? And this is really true. The more we move and the more we continue to move, the healthier and happier we are. Exercise is a natural antidepressant. Did you know that cardiovascular exercise that gets your heart rate up is as effective as SSRIs like Prozac for treating mild to moderate depression without any of the side effects? It really should be the first line prescription for depression should be exercise. Additionally, exercise lowers blood pressure, increases blood flow to the brain and decreases your risk of dementia, decreases insulin resistance to prevent diabetes, and also decreases the risk of many forms of cancer. Now, you might think to yourself, well, I'm not an athlete. I can't do all this stuff and go to the gym all the time. Well, people in the blue zones are not athletes in the traditional sense. They don't go to gyms all the time. They are doing activities that keep them active, whether it's gardening or housework, or they're walking up hills in their neighborhood, and they're constantly walking everywhere. In fact, walking is the number one exercise that you see in the blue zones, right? We've been given these 2 feet for a reason, and we have to use them, right? This idea of use it or lose it. So just being active. In fact, some studies have even shown that just rushing and walking from one place to another for 3 minutes a day can decrease your risk of 10 different cancers by 30%. Walking up 5 flights of stairs, okay, every day, and you don't have to do it at once. You could do one flight and then wait another hour and do another flight, can decrease your risk of a heart attack or stroke by 40%. So we're not talking about that much activity. Right? And that's where it becomes really powerful to think about how just the little things add up so quickly. Another part of the blue zones that we hear about is this idea of how to deal with stress. Right? We all have stress. And in fact, in the short term, stress can be very useful because it allows us to focus and get something done. The problem with stress is if it lasts beyond a deadline or a project or a presentation and it goes to a longer period of time, then it becomes chronic stress. And that chronic stress causes chronic inflammation, and that chronic inflammation leads to aging, right? And so how do you manage the stress, right? We have to develop skills of resilience, whether it's an exercise activity, going for a walk, connecting with a family member, just having downtime. Right? That's one of the things in the blue zones that's not far from here. Loma Linda, the Adventist community, they actually have a Sabbath from Friday evening to Saturday evening where they don't do anything. They just spend time with family. They don't have any electronics. They don't do any work. And they just enjoy life and connect with each other. Right? It's like hitting the reset button every week. Right? Taking time to do that. We have our phones now, which deliver us news all the time, whether we want to hear it or not, constantly interrupting us. Well, that actually affects our brains and it affects our ability to overcome the stresses that we have. So finding ways to manage stress, whether it's a meditation or if you just have a meditative walk, that can be really powerful. Another thing that we see in the blue zones is a sense of purpose and meaning. How many of you have read the book by Viktor Frankl, In Search of Meaning? So this was a book that Viktor Frankl wrote as a Holocaust survivor, and he found that one of the things that really allowed people to survive that horrific, tragic event was the sense of purpose and meaning. Having something higher than themselves to look at and just having a purpose in your life, right? A lot of times in our culture, when we get older, you retire and you don't do anything, right? We should probably reinvent the concept of retirement because when you look at these blue zones, it should be going into the next phase of work and life, right? Whatever that is for you. Maybe you're not doing the same career. Maybe you switch. Maybe you're doing something else for your family. And we look at that age as a wisdom and you gain from that. So I think having a sense of purpose and meaning is really powerful. And that's another thing that adds years to our life and developing that. In fact, Viktor Frankl developed a whole school of psychotherapy called logotherapy, which is basically, instead of, he believed, as opposed to Sigmund Freud, which everyone hears about Freud and says, oh, everything in life boils down to the search for pleasure. You know, Viktor Frankl said, no, what it means to be human is to search for meaning and purpose. And when we look for and find that meaning and purpose, that's what allows us to transcend our experience of what we're in. No matter what situation we're in, if we give it meaning and purpose, that allows us to transcend it to another level and overcome whatever challenges we have. So I challenge all of us to look at these principles, to reflect on how we live our life and how we can play it forward and connect with each other to build that greater sense of community, meaning, longevity, and increase our health span together. So with that, I'm going to pause and open it up for questions. Thank you for your time. Yes. So what's HonorHealth doing to promote this message throughout their staff? That's a great question. One of the I don't know if my colleague Dr. Tiffany Pankow is here. We actually have a wellness officer, and she actually has developed wellness programs for the employees and for the staff. We have Wellness Wednesday seminars that I've spoken at. We have integrative medicine services and other educational opportunities for people to engage in well-being. And also through the Blue Zones initiative, there's going to be a number of events and activities that are going to be connecting people together so they can actually start to learn some of these principles. Because part of the Blue Zones is not just you personally, individually, but community and also workplace. So we're looking very closely at our workplace. What is the food that we have? What are the accessibility to services, to exercise? All of these things are there, and that's why we have a whole director of wellness, and that's a part of the system. And then integrated medicine, I think, is the clinical place where you can do that. And the good thing about integrated medicine at HonorHealth is we accept all insurance. So we have Medicare, Medicaid, and then we have a team of acupuncture, we have dietitian, we have massage, and we try to take that whole person approach to health and well-being. Other questions? Yes?
I have a couple of connected questions.
Okay.
How does your practice compare to like functional practice? Do you do those types of things where you're looking at comorbidities and like cause of issues?
Yeah, so the question is, how does integrated medicine compare to functional? So I think integrated medicine really takes a whole person approach. Functional, I kind of see as a subset of integrative, where someone may have been exposed to something like Lyme or mold and wants to do a deeper dive for like a medical mystery. I think that is very useful and important. Right now, our focus is more on the integrative, so focusing on lifestyle, and it can definitely help someone in that situation, but we may not necessarily do a lot of the more deeper dive tests with that. But we do still look at the ultimate causes, right? Diabetes type 2, for example, the ultimate cause is what you eat and how you live, right? It's not the need for a medication or genetics. So we still look at it that way.
Well, thank you for this because I feel like such a large percentage of doctors you go in with an issue and it's like, here's your, which of these drugs do you want?
Right.
It's not the answer.
Right.
What's causing it to begin with?
Exactly. What's causing? We don't want to treat symptoms with just another drug. We want. In fact, I do a fair amount of deprescribing, where I take people off blood pressure or cholesterol medication as they're able to make those lifestyle changes, and then we use evidence-based supplements and lifestyle changes as well. Thank you. Other questions? Yes. Oh, I can't hear you. Go ahead. The grocery. What was that? Grocery stores. Yeah. Definitely. I think, we have some great grocery stores around, right? Like Sprouts, Whole Foods, Trader Joe's, these places. They really all need to get on board. Farmers markets as well. We do like a demonstration of the downtown Phoenix farmers markets with my medical students every month, where we actually talk about the produce and where you can healthy eating, and we do like a whole discussion with the public about that. But we definitely need to improve our food supply and having more real food. And that's a food policy question too, right? Why is all the Franken food and processed food so cheap and widely available, right? What the Blue Zones initiative is about making what's healthier, easier, and accessible. Right? That's, if we really want to be true to it, that's what we need to do. And that includes the infrastructure, right? It should be easy to make the healthy choice. It shouldn't be easy to make the unhealthy choice, which is what the case is right now. And as long as we have that, we need to shift things in the other direction. Yes? So beyond education, what can we individually do to create a culture? Well, I think you start with yourself in terms of looking at transformation in your own family. And then I think we form groups and organizations, right? We use the structure of Blue Zones and use that as an excuse to get together, right? We have activities together. We do things. We form our own mo'ais. We have our own communities that we do. We start getting together and doing exercise together, do cooking together, right? Start doing these healthy activities together to build that sense of community. Don't just do it in isolation, because the together part is actually part of the equation for health. So I think that's really important. And once you start doing that, it just spreads, right? Just like with marketing, a lot of times things spread mostly by word of mouth, right? So if we start doing that individually and connecting and building that community, we can actually make a difference in our community. Yes? Yes. So that's Great question. What is the role of alternative medicine systems like traditional Chinese medicine, Ayurveda, indigenous healing systems? Absolutely. And that's part of integrative medicine, is to bring that in. And I want to be able to work more with experts who are in that space to bring more of that in. Part of what we do in integrative medicine as a physician, in addition to your primary specialty, we do a 2-year fellowship where we learn about all these systems and we learn about when and where and how to connect, but we also need to connect with these healing practitioners. We need to bring them into the fold, right? Because it's not to say just go over there and do that, but it needs to be integrated, right? Integrated is about the best of both worlds. Sometimes you need a medication or surgery. Other times you can avoid it by how you live your life. And there may be a healing ceremony that can empower you. We shouldn't say no to this or, oh, that doesn't work. Bring it all together so we can go. So I definitely think there's room for that. Yes. Whoa, one more question. Okay, go ahead. Yeah, so the question is, do you see this as improving people who have autoimmune or hormone thyroid problems? Absolutely. I think we've seen a big jump in autoimmunity in the last 40 years. A lot of it, I think, has to do with the foods and the processed foods that we have, because we haven't been exposed to these, genetically over time. Now it's like your body doesn't know what to do with it. That's why you see like rampant people with having gluten sensitivity and different things. They may not have celiac. But then I know that they've done studies where they found people who are gluten sensitive. They don't have celiac disease, but they're gluten sensitive. But if they eat a grain that was unprocessed, not modified from 2,000 years ago, they don't have that sensitivity. So I know that, and we see peanut allergies, all these things, but we're changing the food and we're creating these frankenfoods, and it's like a big experiment. So we don't know what we're going to get from that. So I think the integrative approach is really to get back to our roots. It's evidence-based, scientific. We have both worlds, but we're also trying to learn about ancient wisdom and just how things evolve naturally, rather than just like trying to make everything a chemical solution. Okay, great questions. I know we don't have time for any more, but I'll be around, and we have our knowledge tent over there as well. Thank you very much for your time. And stick around for the culinary medicine demonstration with Chef Badman in a few minutes.